Dr. Chen. I have an integrative medicine practice in San Jose, California, and I help patients with their supplements and their diets, as well as combining that with their medication and conventional treatments. The health benefits of chromium is that it is actually an important part of insulin function in our body, and insulin is a hormone that we need in our body to help regulate blood sugar so that when we do eat foods that they go into the right places and be used as energy instead of being stored as fat. So chromium is important for sugar regulation and balancing. Surprisingly, there is a lot of mild to moderate deficiency in chromium in the US. And the reason for that is that chromium are found in foods like vegetables, meats, and whole grains, but we only absorb about 0.4 to 2.5% of that anyway at our optimum amount of absorption. And as we get older and our body is more stressed and inflamed, we don't absorb as well. And then certain foods that are more processed and refined and high in sugars, you don't get a lot of nutrients because there's just not a lot in there. So, and also a lot of these factors also cause you to lose more from your body from your urine and stool. So that's why sometimes it's important to take the supplement because you're just not going to get enough from your foods. So I generally recommend most people to have chromium in their regular supplement regimen. The reason, again, because of that high prevalence of people who don't have enough chromium in their system, and because it's such an important part of insulin, which is a very important hormone in our body for processing foods and balancing sugar, that I generally recommend chromium for everybody. The general dosage for chromium that I recommend for people is about 200 micrograms of the chromium polynicotinate. There's a lot of other forms out there, so I want you to get the one that's called chromium polynicotinate, primarily because it was seen to be safer and better tolerated in studies. And also, this form comes with chromium plus the vitamin B3 niacin, and niacin helps with cholesterol and triglycerides as well. So chromium actually, because it helps with insulin function, people who are diabetics should not be taking the chromium without checking with their doctor about the appropriate dosing for their medications now that they're going to be taking chromium, because the chromium might make your insulin own native kind of natural insulin function work better. So if it does, you're naturally able to put away the sugars a little better, in which case you may not need as much medication. So first things first is you want to check your sugars more often if you're starting any new medications or supplements like this, and then check with your doctor about whether you should dose adjust your medications now that you're taking chromium. Well, chromium generally long term is relatively safe, but one thing that you want to think about is that you want to be, if you're pregnant or you're breastfeeding, any and all supplements should be checked with your doctor before starting or taking.